This episode of the Burnout Recovery Podcast is brought to you by MEGA, your medical indemnity partner. Whether you're starting out in your career or have decades of experience, MEGA helps you thrive with support that goes beyond insurance. Enjoy travel benefits like complimentary travel insurance and Qantas points on your membership, plus education, medico-legal support, access to career coaching and wellbeing resources. Visit mega.com.au to learn more. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au. Burnout isn't just exhaustion, it's carrying too much for too long. Heidi takes the administrative load off clinicians so you can focus on what matters, patient care. Recovery starts with removing what drains you. Try Heidi for free at heidihealth.com.
Welcome to the Burnout Recovery Podcast, a guiding resource dedicated to healthcare professionals on their journey to overcoming burnout. Spearheaded by Dr. Joe Braid, a certified professional coach and rehabilitation physician.
Welcome back to the Burnout Recovery Podcast. I'm Dr. Joe Braid, and today we're talking about something that's probably happening in your brain right now as you listen to this, the mental load. You know that feeling when you're trying to focus on a patient, but your brain is also thinking about the clinic letters you need to complete, the family meeting you need to schedule, whether you remembered to call back that colleague, and what you're going to have for dinner. That's the mental load, and today we're exploring not just why it's exhausting our healthcare brains, but how it's impacting the relationships that matter most to us. So I was reminded of this recently when I was connecting with some of my doctor coach colleagues on one of our monthly calls. We talked about switching off over the summer break, and one of the doctors said she hadn't closed her laptop down for several weeks, for years. It took getting support and systems in place to make the difference. She could go away camping to a location without any reception and be confident her business would keep running. And even though I'm talking about business as opposed to maybe being employed in a hospital and so forth, I think there's relatability here and really lots of strategies and tools so you can relieve yourself of that mental load for certain times during the year. So that conversation we had took me back to something I discussed in an earlier podcast episode about cognitive load. But it also connected to something profound I learned in my Stanford WellMD Director of Wellbeing course about the impact of work on personal relationships, often shortened to IWPR, if you want to look it up. I remember this happening when I was in the depths of burnout years back. I was having dinner with my family, trying to be present, but noticed this background hum in my mind. A running list of all the things I needed to remember and manage. My family were talking about their day, but part of me was still mentally focusing on patient issues and planning tomorrow's schedule. It's like having multiple browser tabs open in your brain, each one using up precious mental energy that really is better to be available to be around for those people we love the most. What struck me from the Stanford research is that this isn't just about being tired. It's about how our work literally follows us home in our minds, creating what researchers call work-home conflict that can damage our most important relationships. So in my earlier podcast episode talking about cognitive load, which you can go back and check out if you wish, I explained how our brains have limited processing capacity. Today, I really want to build on that with some eye-opening research from Stanford's WellMD Center about how the mental load specifically impacts our personal relationships. We had a talk from Dr. Jessica Gold, and her research revealed that over 40% of physicians report a moderate to high impact of work on personal relationships, with 21% reporting high impact. And here's what's concerning. Physicians with impacted relationships show higher occupational distress, increased burnout, and even more patient complaints. The mental load includes three components that directly affect our relationships: Cognitive labor are the thinking and planning that continues into home, which I referenced earlier in my short story there. Emotional labor. So we can certainly have feelings from the workplace, and those can spill into our personal time. And thirdly, the invisible labor. So there's lots of coordination work that our families may never see, but that can be really quite exhausting for us. And here's what the research shows about how this mental load impacts our relationships. Women physicians are disproportionately affected, especially those with children aged 5 to 12 years of age. The constant cognitive switching between work responsibilities and family needs creates what researchers call role conflict. And our partners and our children often feel like they're competing with our work for our mental presence. And I know I've been in this situation before, for sure. A 2023 study found that healthcare professionals carry what researchers call professional mental load, that cognitive burden that is constant and extends beyond work hours. But here's the critical insight from the Stanford research. When we can't mentally disconnect from work, our relationships suffer, and when our relationships suffer, our work performance actually declines too. So you can see that loop where the work is connected to home and the home situation connects back to work. And that invisible cognitive burden that follows us home includes worrying about patients after hours, mentally rehearsing difficult conversations, planning clinical decisions while trying to be present with our family, and carrying that emotional residue from challenging cases into our personal time. So let's talk about managing this mental load in ways that both protect your well-being and your relationships using my framework of sleep, support, mindset, and movement. I'll start with mindset strategies for relationship protection. So firstly, notice when work thoughts are stealing your presence from loved ones. That's just growing that awareness to start with. Practice intentional transitions, so creating those mental boundaries that protect your personal time, and reframe being present. Your family really needs your mental presence, not just your physical presence. You know what it feels like when somebody's physically there, but they're kind of checked out. And that's what our patients also recognize. Secondly, support systems that protect relationships. What happens when you go away? Who covers your inbox? Is there a system in your department that really allows true disconnection during time off? How are your schedules? Are they fairly predictable, or are there last-minute changes that disrupt family plans? How can you laser in on minimizing last-minute changes? And thirdly, team mental load sharing. How can you distribute cognitive responsibilities so no one person carries everything? Movement. Before entering your home, take 2 minutes to mentally transition from work mode to family mode. I've shared strategies around this before. It could be a movement-based activity. It could be breath work. You could do the work parking lot. So that's taking out a notebook or using a voice memo to just write down some work thoughts before you go home and engage with your family. And then have some really protected time boundaries. So establish specific times when you're really not thinking about work. Strategies that I use around this are definitely playing a game together, doing sport together. Recently we were away and we ended up having this evening fun of cooling off in the Murray when we were staying in Mildura. And as a family of 5, we play catch in the Murray. And I think the kids' trick was to try and make mum and dad like really stretch out for a catch. So we'd go south into the water. They found that particularly hilarious. But I knew we were all very connected there, and certainly nobody was thinking about work if they were trying to catch the ball without doing a belly flop. Sleep and recovery for relationships. Practice the mental handover and consciously hand your work concerns over to your tomorrow's work self. So this is letting your future self take care of the work for tomorrow. So here's the 4-step relationship protective mental load reset. It's 4 different steps. You might find this useful from this podcast episode. Firstly, acknowledge. I'm carrying work stress that is affecting my presence at home. Secondly, externalize, write it down or make a voice memo to record your work concerns to address later. Thirdly, transition. Think about a physical action. Maybe it's changing clothes, maybe it's washing hands, maybe it's doing a short movement to signal that you've got a change in your mode of where you are. And fourthly, ask your family, how can I be most present with you right now? Based on the Stanford research, advocate for, in the workplace, meeting schedules that respect personal time. So you're not having meetings before 9 a.m. or after 5 p.m. Advocate for reliable vacation or holiday coverage that really allows true disconnection. And that takes a bit of planning and departmental support and knowing, when your vacations are planned. And support systems for difficult clinical experiences so you don't have to be bringing so much emotional residue home. And we know it takes different amounts of hours and days and time for people to release or feel lighter from the emotional residue that they might have from a critical incident in the workplace. But if there is some kind of support system that you can tap into there's less that you're carrying when you leave the workplace. So here's some suggestions for what you might want to do this week. Try the relationship reset ritual that I just listed there. Before entering your home after work, take 2 minutes to mentally transition. It doesn't have to take too long. Ask someone you love, do you ever feel like I'm physically here but mentally still at work? And just listen to their honest answer. And thirdly, identify one work mental task that you could externalize to protect your personal time. Some reflection questions for you. How might my relationships improve if I could be more mentally present when I'm not at work? And what would it feel like to truly disconnect from work and be fully available to the people I love? And what's one change I could advocate for at work that would help protect my personal relationships? Maybe you want to have a chat with a colleague at work and ask them, do you ever feel like work follows you home in your mind, affecting your relationships? The Stanford research shows this is incredibly common and you're not alone in this struggle. If you want to explore more strategies for protecting your well-being and your relationship, join me and the community at the Healthcare Leadership Hub on School. We're building a community where we can share practical solutions for these challenges that affect our whole lives, not just our work lives. Remember, your relationships are not just important for your happiness, they're essential for your health and your ability to show up fully in your work. You deserve to be fully present for the people you love the most. Until next week, practice being present and keep connecting with what truly matters. Thanks for listening. I'll talk to you again soon. Ready to take the next step in your burnout recovery journey? Visit drjoebraid.com for free resources, all 150 plus podcast episodes, and information about my keynote speaking. Links are in the show notes. Your well-being matters. Protect the asset that is you. If you're a clinician trying to protect your energy this year, hear this. We all know how the invisible work drains us. Those endless notes, follow-ups, and admin tasks that happen after every patient leaves. That's where Heidi comes in. An AI care partner that quietly handles the documentation while you stay focused on what matters, patient care. It's not another system to learn, it's support that actually reduces your cognitive load. Try Heidi for free today at HeidiHealth.com. Be your best you. Rely on MEGA for your protection and support, serving doctors for over 125 years through insurance, education, medical legal advice, and member benefits designed to help you thrive and succeed. Insurance issued by Medical Insurance Australia, which has not taken into account your objectives or situation. Before you make any decisions about our policies, please read our PDS and consider your needs. Call us for a copy or visit mega.com.au.